People I work with often say, I just want to be a civilian. I just want to be a civilian. But there aren't enough systems to scaffold what it truly means to be a civilian. And I was like, this isn't really me. So I wanted to bring a different way of being a clinical psychologist. And somebody asked me, what do you think we need in order for this to change? And I was like, love. I actually don't think there's enough love in the world. And I'm not even just talking about young person to young person. I'm talking about us as adults to young people.
We have been free social workers, so thank you.
South is where it's at.
Hello and welcome back to the Social Matters podcast. We are free social workers talking about social matters. Hi, I'm Eugene.
Hi, I'm Fran.
Hi, I'm Nadia.
And we are joined in the room by somebody who came dressed for the occasion. We were just talking about how coordinated we are. Like when you walked through the door, Ron, and you weren't wearing like
You would've kicked me out,
we would have
yeah.
kicked you out. Yeah. But welcome to the podcast. It's so good to have you in the Social Matters studio, Social Matters space. Just to give a bit of an intro, I'm going to go on my phone because I just saw all of your kind of titles and your skills. I was like, I need to make sure that I get this right. So Ron, you are a man of many talents and skills. And the ones that we've chosen to bring to the forefront today is the fact you're a clinical psychologist and a co-founder of an organization called Psychologists The Streets Deserve, PTSD. And your work brings together clinical psychology, community experience, and social justice.
I feel like before we go in, I feel like we need to check in a little bit. How you doing, Ron?
I'm all right. No, I'm all right. I'm excited.
Yeah.
100% excited.
Yeah.
Still compressing like the morning, or decompressing even, the morning that I've had around some of the training around, as I mentioned, harmful sexual behaviours. Really, really fascinating stuff. So it's got me thinking a lot. And actually thinking about the work that I do with young boys and young men anyway. Yeah. So really thinking about how do I feed some of this stuff into what I'm already doing.
Good
Nice.
stuff. Yeah.
So our first question is, how's your own kind of lived experience shaped how you've entered the work and how you understand trauma? Because that's what we're going to be really thinking about today.
I don't think many people really know who I am, or I guess, or more so my trajectory into becoming a clinical psychologist. They see the end product, the output, but not many, bar the psychology work. I do a lot of lecturing. I try and give back to universities that train clinical psychologists. So they often get a bit of an insight into my upbringing. But I am unapologetically a South Londoner. It's a big part of my identity.
I didn't know that.
No.
Yes, done, innit?
It's
like,
a
we've
big
got to wrap it up.
part.
All right.
Joke.
We have been free social workers, so thank you.
South is where it's at. And I guess growing up, I don't know how old people think I am. Not many people even know how old I am, but I'm 34. So I'm a millennial. And my teenage years were at a time when South London boroughs had horrific levels of gang-affiliated violence and murder, actually. So growing up in the area that I did, Wandsworth, was often seen as a bit of a bridge between two very local prominent gangs. So you had a gang operating in Tooting and Mitcham. And gangs often have quite creative names, so they're called TZ, Terror Zone.
Okay,
Put on a t-shirt.
And then in Clapham Junction and Battersea, you had SUK Stick-Up Kids. And if you know the geography of that area, you have to pass through Wandsworth if they were trying to enact harm to one another. So Wandsworth then often became quite a very problematic area that saw high levels of violence. And I guess I was going to school with people who society might label gang members, had family that might self-identify as being gang members. And I guess growing up, I was often directly, indirectly being exposed to traumatic situations by virtue of the area that I was just living in. And from a young age, I've always been curious about people, been curious about how me and my friends had to adapt our behaviors in order to respond to the situations we found ourselves in. And then that just carried me through. I often talk about how I think education, it sounds really cliche, but education saved me, actually. I've always been a curious person, and I've been really fortunate to have teachers that scaffolded my love for learning to ensure I didn't take the wrong path. And even at times when I did, there was a bringing back, which I know a lot of young black boys have never had the access to. So I feel very, very privileged about that. But going through all of these different experiences, I think that's what has definitely shaped how I view trauma. I understand that trauma doesn't discriminate between individuals, irrespective of who they are. It's made me understand that people can be all of the above in terms of perpetrators, victims, and witnesses. So then it becomes really hard to untease trauma.
It's so you described it so well in terms of like how like your geography really shaped like you know, kind of your experiences and how you navigated growing up, but then it would have, you know, undoubtedly had an impact on how you.
How could it not have? How could it not have? Yeah, it was really, really heavy actually. So, and I guess part of the PTSD work that me and Amber do, Amber's also from Wandsworth. So we both have had very similar but different experiences within the same borough. And I think that's also connected us, which is why we formed PTSD, Psychologists The Streets Deserve, as a response to lots of young people actually wanting support, but not feeling like they could go to the NHS for support.
Sure.
And I think that idea, what you're just saying around trauma doesn't discriminate, I think sometimes, and I think we're probably going to go on to talk about this a little bit, but I think when people see somebody who is maybe gang affiliated or maybe involved in difficult stuff like violence and things like that, they only view them through that lens and not 100%. Somebody who can be both and then we just relegate that and just think about the criminal justice system, very punitive responses 100%. To especially young kids in those situations. So really helpful conversation, I think.
I like that's really resonated with me already, the kind of the victim, perpetrator, witness. I think that is so powerful to think of those things. And I love the name, by the way. I love like names. Like in my football team, I make up everybody's name. So good play on words or good acronym. I thought
love that. I love a play on
and
words.
that's you've captured it beautifully.
It took a lot of thinking.
Who was that your?
I mean, I'm going to claim it. Or me. But no, I've always been, I love that. So like, even when it comes to like fantasy football, I'm like, what cool name can I create for my team? I'm a Chelsea fan.
Oh
so
my
I'm
God,
always
it's
like,
going.
so I was like, oh, my name this year is going to be Cold-Blooded.
Oh, like
Cole Palmer, Cold-Blooded. And I was like, wow, all right, I'm really good at this. I'm really good at making up names. But PTSD, we kind of, and me and Amber, like there were actually lots of different variations, but we ended up on Psychologists The Streets Deserve, actually through conversation with young people. There was something around us wanting the name to have been, I guess, checked by the population and community that were going to be accessing our provision. People felt like that was the one. That's what landed. I was like, all right, we're going with it.
Amazing. So could you tell us a little bit more about PTSD, about the work it does, how it impacts young people?
We're still, I guess, I articulate us as a bit of a baby organisation, really. So we set it up formally in January this year.
Oh, wow.
Very, very new. And I kind of mentioned it before, but it was in response to the fact that both me and Amber have worked many years within the NHS across various different environments where we would have expected to have seen young people who experienced community violence, but they weren't there. And actually that made us think about what is going on here, because in our kind of own indirect ways, we had access to young people to know that they wanted help. They just didn't want it in the formal statutory ways that it's often provided. So we were like, we have to set something up here. And when we were setting up the organisation, we didn't want it just to be about young people. We also wanted to work with the system surrounding young people. And that's where we do a lot of consultancy stuff with families, trying to eventually infiltrate like the policy level stuff. A lot of our work at the moment, interestingly, is expert witness reports. So we've kind of infiltrated somewhat the criminal justice system, and lots of solicitors are now getting in touch with us because they want us to advocate on behalf of their clients by helping the criminal justice system think about trauma and PTSD.
Amazing.
Wow. Amazing.
Such an important space.
And is there, just on the criminal justice system, is there anything else like that out there, or is it something that's emerging, or are you one of the few people who are doing this?
Great question. I would say we are one of the few non-white people doing it.
Oh, interesting.
So expert witness stuff has been going on for ages.
Yeah.
Where I will give somewhat credit to the criminal justice system is that even the fact that they're now exploring things like trauma and PTSD, I think is already a huge win. Because I don't think this stuff was occurring before. The dangers that exist within this field, though, is that you have lots of professionals who don't care about the young people, because actually expert witness reports often come with quite a nice pay package. So lots of people just do it for the money, unfortunately. So I've come across people that have done reports. I'm like, you didn't care about this young person. And that shows through the assessment that you've done. It shows through the report that you've generated. So then I guess that also fueled a bit of a fire for me and Amber, that we want to do this properly, and we want to do it in a way where we can also somewhat support other people doing expert witness reports. So we've had people reach out to us that already do them. Like, I'm working with young black boys. I can identify, can we have a bit of a conversation to almost like highlight some of their blind spots. Yeah, it's been fascinating.
So important. And I suppose, you know, thinking about like different levels of change and influence, and I guess that being at the kind of structural, institutional, to think about bringing that trauma lens into criminal justice system. Are you seeing any like shift in terms of movements within the view in terms of kind of sentencing, perception of young people, judges' decisions? Is it hitting that level yet? Are we seeing that?
Do you know what's fascinating about that question? That there isn't kind of like a closed loop that occurs. So we often don't even get information back from the solicitors about the outcomes.
Right.
Wow.
Which is almost, it's so bizarre when you think about it.
Yeah.
So I actually can't answer that.
Yeah.
I actually don't. I guess the hope is that because judges are usually the ones who should be reading these reports, there is a hope that they are reframing how they are viewing young black boys in particular, actually, and young black men, and hopefully applying the terms of trauma and PTSD to their experiences. So it kind of negates away from the typical language around gangs or violence or whatever, or ADHD, or all of these different mental health disorders that are usually attached to young black boys and young black men that don't often come with compassion. And I think when people hear trauma, when they hear PTSD, it changes how you then view the situation.
Yeah,
The
it shapes
power
the lens ever so slightly.
The power of language is so fascinating.
Yeah. And I suppose it would require a whole system overhaul, wouldn't it? Because I guess, you know, in asking that question, I'm thinking we don't even have the facilities to respond, you know, in a more helpful, compassionate trauma way, do we? Because it's almost like, you know, young offending institution, or like, what, do you know what I mean? What is the difference? So it's almost like, breaking down at every level of the system, but actually what other alternatives are out there?
100%.
Anyway, sorry, just ideas of like crush the system. But a brilliant and important space to be in terms of expert witness.
I was going to ask about Juvenis. Oh yeah. What's Juvenis? Tell us about Juvenis. Is that am I pronouncing it correctly?
I feel like this is like the third conversation I've had this week. Am I pronouncing it properly?
Oh.
And then it makes me think, am I pronouncing it properly? Because people say Juvenis, or Juvenis. And I actually don't think I've ever asked Winston, what is the name of your organisation? Because I just say Juvenis. But I think it's because I've heard him say Juvenis.
Is he Italian?
No, it's Latin, apparently.
Yeah, and I'm just thinking because of the football team.
Juventus.
Oh, Juventus. So
I read it as Juventus, but it's not, is it?
Yeah, because it's meant to be Latin for like child or something related to like adolescent.
Yeah, maybe it is
juvenile.
Yeah.
But they are a charity based in Brixton. And it was predominantly a charity that focused on, I guess, mentoring. Winston comes from a youth worker background. And lots of their provisions, I think they've been going on for like 10 years now, very established within the Lambeth Brixton area. And I guess what I've now done is add a helpful addition around the psychological element to the work, where lots of young people will come to me for direct clinical PTSD and trauma work. Which again it's not unheard of, but there are so many narratives that exist around young people generally that they don't want help, they don't want to speak to anybody. And what I love about this work is that it challenges that narrative, because young people do want to talk. It just needs to be in an environment suited to them.
Yeah, that's one of the things that's always stuck in my mind in my time as a social worker, when a family or child will be labelled as non-engaging. I'm like, don't jump to the non-engaging statement. What have you tried to adapt yourself in many ways first, but to engage them? And what you just said just reminded me of that, is that actually you've created a context and environment, and also who you are as a person and how you show up, that has meant that the young people can access a service that they probably always wanted. And like you said before, it's just like the kind of maybe traditional NHS way of it doesn't fit with them.
100%. And even in the psychology world, we have our own terms that we use. They're not psychologically minded. What the hell does that mean? What does that actually mean?
What does it
Psychologically
mean?
minded? What?
Yeah.
So bizarre how
Yeah.
systems operate. Honestly, it's so bizarre.
Gosh. And I was just going to go off topic again, which is so like no, but just about like your experience of the training as a black man, training in psychology and thinking of even just you saying that, like the psychological mind is some of that kind of language. Yeah. How was the training?
This is why I give back to the next generation of clinical psychologists.
Yeah.
Because I remember the first time I was ever lectured by a black male clin psych changed my life. Because there was something about, so the makeup of clinical psychology is typically middle-class white women. So I knew I was entering a profession where I was going to be the minority anyway. But I trained at the University of Hertfordshire. What I didn't expect was to be the only black person on my cohort out of 23 of us. So that was a very difficult experience because I also started my training in 2020 after the killing of George Floyd. So what people don't often talk about enough, I think anyway, is how social political things going on in society impact the individual. So like if I'm honest, I was second guessing myself a lot when I started training because I was like, am I only here because George Floyd died? Because these are unfortunately the unhelpful cognitions and narratives that often go through the minds of black people generally because of the systems around them, that I often have felt I have to either prove myself really hard or I'm just a token black person here. And that kind of warped somewhat my experience on training. But after I got onto training, I was like, you know what, I'm here now. I'm actually not even going to overthink why I'm here, how I've got here. Of course, I've probably got here because of the amazing man that I am. So there was a lot of me having to like retrain my mind to just acknowledge I'm here for a reason and I'm going to utilize this. So during my training, I was just absolutely a disruptor. I was like, I'm here. Let me cause problems.
I love that.
Let me cause problems. What can happen? Let me cause problems. And I also wanted it to be an opportunity to think about the type of clinical psychologist I wanted to be, because at the time I was gaining some level of understanding around clinical psychologists and NHS spaces, how robotic they tend to be, how I guess the environment forcing them to behave and act in particular ways. And I was like, this isn't really me. So I wanted to bring a different way of being a clinical psychologist. Training was hard. It's 3 years, really, really hard. I guess I just had to find ways to cope, if I'm honest.
Love that.
Yeah, love that disruptor element. I'm just going to look at the question to get the name of your research right. So you've carried out research and published a paper titled "The Life of a Top Boy." What year did you publish that? Was that?
What a great question. No, I'm going to say...
It's not a quiz question, by the way. I don't know the answer.
I
felt like I had it here.
2023. So I finished even that feels weird. I finished my clinical psychology training in 2023. And in order to become a qualified clinical psychologist, you have to do research. So this was my thesis ultimately, which concluded in 2023. And then at the time, me and Winston were thinking a lot about how do we disseminate this to young black boys, young black men who are the ones that we wanted this research to be for anyway. So then we created the report, The Life of a Top Boy, as a way to kind of minimize the 36,000 word thesis that I did into something that actually people were going to read and could make a difference to kind of stakeholders, policymakers, as well as young black boys and young black men. So I think that came out. It came out on International Men's Day, but I don't know if it was in 2023 or 2024. I just know it was International Men's Day.
I love that idea of the like using it as well, isn't it? Because it's a lot of kind of blood, sweat, and tears, no doubt, into that.
100%.
And actually, how can you make it used for the people who you want to
support? And that's what I say to trainees, that because you are doing research in order to become a doctor in clinical psychology, don't just do research for the sake of it and then think that your research should be left behind closed doors.
No.
Your research can shape and impact people's lives. You need to do something with it.
It's massive. And in this research, you highlighted that young black men describe violence as becoming normal, sort of part of everyday life. So from your perspective, how does that normalization influence trauma responses and mental health?
Hit me. That is, yeah. Do you know, so the first response that comes to mind is the fact that they are often desensitized and the emotional numbing. So those are trauma responses anyway. And lots of young people who are actively exposed to community violence, it just becomes second nature. And I guess that's the normalized element of it, where I guess it can then increase the likelihood of them engaging in violence because they're not thinking about consequences. So even when we think about from a brain development perspective, the brain is developing up until 25. So lots of young people are still going through a process of where the prefrontal cortex hasn't formally been established yet. Their amygdala, which is, I guess, where we associate the fight, flight, freeze response, it's constantly being activated because they see threats everywhere. So young people who are exposed to community violence over and over again, the idea is that their amygdala becomes hypersensitive, where it's just constantly triggered by anything. So then you see threats anywhere. And like, there's an example I often give with the trainees that I lecture around doing a workshop with a young person, went into my pocket to get chewing gum, and I could see the reaction that the young person gave because he didn't know what I was doing. And I could see the visceral response in his body because irrespective of the trust that we've developed, he saw that action, which then created fear. I don't know if that's answered the question. Or given an example of it. Yeah. But then even with, so I don't know if I said this at the start, but I guess my specialism is around trauma and PTSD. But that often comes with an acknowledgement that young people will have issues of anxiety, low self-esteem, depression, in some cases psychosis, where actually a lot of them are taking high levels of crazy drugs, and not really understanding the impact of that on their developing brains.
Yeah. And it was just making me think about like how much of this is unspoken amongst young people, because one of the things that always, and I think I connected more with this when I was older, is that there's so much, especially amongst young men, there's so much unspoken activities or things or brain activities that's going on between people. Everyone is thinking in a similar way or experiencing things in a similar way, but there's something that means that you can't talk about it. So you have 5 young boys in a room together, and all of them are experiencing trauma in one way or the other, PTSD in one way or the other. But the environment, that local context of them being 5 boys maybe involved in gang violence, and the wider societal context of what it means to be a masculine man, means that we can't all say like, "What are you all feeling afraid? Were you all scared when that lecturer put his hand to grab the chewing gum?" Like, and how do we create an environment where that becomes normalized, or space? And you've done that in your work, where at least on a peer-to-peer, one-to-one way, somebody feels they can talk about that.
But I guess the way that I attempt to do that is holding people accountable. But I kind of often frame it as I give tough love. Like the love acknowledging the experiences that they've had, but the toughness that I have to hold you accountable for the things that you've done. Like, you can't think you can get away with the things that you've done to people. And this is the tough love element. But I also, I guess, help or try to support young people in having those conversations with their peers. Because for me, those things won't change unless somebody is taking a bit of a leap of faith to see how that will land. Even as a grown man, me and my friends struggle with that. Because we've never had the scaffolding to really support that process. And even when we do talk about distressing stuff, as you probably know, it's often laced with humor in order for ourselves to feel comfortable to even do it. So this is me speaking as a 34-year-old man. Imagine a 12-year-old, a 13-year-old, they're still trying to figure out, how do I even do this? Like, how do I bring it up in my peers where I don't look vulnerable? I don't look like somebody can take the mick out of me. Like, they're thinking about all of these different factors that might impact on their own identity and how others are perceiving them. It's a lot to think about.
It's exhausting.
Very exhausting. Yeah.
It's a lot, like cycles of exploitation. Like it's exhausting. Constant hypervigilance and constant kind of looking out And then, you know, we're then in spaces where like, oh, but you got to function in school, like, where you got to, you know, just be able to, you know, you know, function. It's just, there's so much. There's so much.
We have high expectations of functioning generally. And I don't think that's even just young people. So I do a lot of work in prisons as well, I guess, as under the umbrella of PTSD. And I'm often talking about the criminal justice system and the prison system not scaffolding reintegration back into society. Because lots of people in prison, I'm not even in prison, but lots of young people I work with often say, I just want to be a civilian. I just want to be a civilian. But there aren't enough systems to scaffold what it truly means to be a civilian. So like I recently worked with a young person who knows nothing about taxes. He's like, why do I pay taxes? I'm like, why does he pay taxes? I don't know. You know what I mean? But these are the things that they don't know about. And because they don't know about it, it then drives them back to what they know.
100%.
There's no scaffolding for all of the things that we take for granted at all.
I mean, I'm not even sure why we pay taxes.
I was going to ask that.
If you find the answer to
Honestly,
that,
they ask me fascinating questions. I'm like, hang on.
So we're coming to the end of our conversation, but we just wanted to kind of ask you about your hopes, like the hopes that you have for the future, for, you know, how we might be able to kind of think about the healing, the support, the pouring of love into our young people. Like, what kind of hopes do you have for that?
I think love is the crucial word for me, you know. I was having a conversation before and somebody asked me, what do you think we need in order for this to change? And I was like, love. I actually don't think there's enough love in the world. And I'm not even just talking about young person to young person, I'm talking about us as adults to young people. There is such a disconnect. And I can understand where that disconnect comes from. I think there's an element of fear around safety usually. I guess that idea of people might see young people fighting other young people. What do you do in that situation? But I often think we have an obligation as adults to really check in with young people generally and actually just see how they're feeling. Hope. Whenever I answer questions, I feel like I take a multi-pronged approach in terms of like hope for myself, hope for young people, hope for the systems around young people. For myself, I guess I'm quite a baby clinical psychologist. Like I graduated 2023, so I've only been a qualified clin psych for 2 years. And I say that because I'm very thankful for what I've been able to achieve in those 2 years. But the hope is that I still have that fire and burn in me to keep going for like the next 10 years. So for me, that's where I'm quite content and happy. And even when I think about some of the accomplishments that I've been able to achieve, I think because this year I was asked to become a member of the UK Trauma Council. And like for me, that is crazy because I'm like, I'm baby food. What is going on here? But I think it's nice when there's, and I guess it's a national recognition of the work that I'm trying to do. So the UK Trauma Council is literally just a collective of experts that are academics, practitioners, researchers, who have some level of expertise in childhood trauma and mental health in the UK. I'm like, I can't even believe I've been asked to do this. But these are the things that I guess fuel the fire in my belly that I just need to keep going. And yes, do not get me wrong, this is not easy. I'm listening to trauma all the time. I'm having to process my own stuff. I'm seeing the anger that I have towards the system surrounding young people. And there are days, of course, I'm like, why do I do this? This is actually a lot. And there aren't many clinical psychologists in this space anyway. So there's an element of sometimes feeling quite lonely. So that can be quite heavy. But I see young people again and that they chuck that out the window. Do you know what I mean? I'm like, this is why I do it. My hope for the young people is to continue what they're doing, in that I see on a consistent basis with young people in all of the different environments I work in, they want to speak to somebody. They do. And actually, I that's my hope for young people, that they continue to have that desire and the drive to speak to somebody. It doesn't need to be me, just somebody. And actually have helpful adults around them that will help to guide the issues or concerns that they might have. And then from a systems level, this is where I'm quite thankful for the work that I do with the expert witness reports, because that has been quite a live experience for me to see how a rigid system like the criminal justice system has somewhat shifted. And even though that shift might feel small, I think it's a massive shift.
Because
gives hope.
I've worked with a lot of young people before where the words trauma and PTSD were never associated with them. So for me, that has been a massive, massive win. And I kind of just want to see how different systems respond to the work that I'm trying to do. So the education system eventually.
Love that. Ron, I've just been sitting there listening to you speak. I'm thinking like, it just feels like a little mini lecture, but you've just, I think it's the way that you're talking and what you're doing and your perspective on young people and trauma and what we need to be doing is so kind of important now, but a pleasure to listen to live. So really, really appreciate it. Thank you so much.
Thank you.
Also, if people wanted to find you or find out more about your work, where would they need to go?
Predominantly, I say on Instagram. I'm trying to build up my Instagram presence.
Nice.
So my personal Instagram is The Accessible Psychologist, and then the business is PTSD London.
Nice. You're good with names, aren't you?
Like your top boy, PTSD.
We have been Free Social Workers talk about social matters with the brilliant Dr. Ron Dodzro. You can find us on social media at Matters Podcast, on Instagram, and Social Matters on LinkedIn and YouTube. Please follow us, comment, let us know your thoughts on this conversation when thinking about trauma and young people. And if it resonated with you, then get in touch with us, get in touch with Dr. Ron, and we'll be more than happy to continue the conversation in one way or the other. Thank you, everyone. Continue the conversation. Thank you, Dr. Ron.
Thank you.
Thank you.